Now we are so grateful that you're able to join us, and we apologize for the technology glitch. So Brenda, will you update us on what we were doing in our waiting time?
Sure. So we decided to make the most out of our extra time while we figured some things out. And so we decided, we talked about grounding a little bit as a way of relaxing and focusing in on our present moment, because so much of our anxiety has to do with things we worry might happen or have happened in the past, and how grounding activities help us bring our attention to the present moment. So we did the 5, 4, 3, 2, 1 grounding exercise and activated our senses in order to help bring us to the present moment.
That was so helpful for me. I could see on my watch that my heart rate slowed down because technology glitches make me anxious. So I want to check with our tech team. Do we have Dr. Michelle Brancer on now? We do. All right. So we are so happy to welcome to this session on mental health and introduce Dr. Michelle Brancer. And she has such a long alphabet after her name. I'm going to read it though, because I think it is really important for us to understand the amount of expertise right here in the Navajo Division of Behavioral and Mental Health Services. A PhD, an MAC, an LADAC, an LPCC, and a CADS. And she is with us virtually. She has 24 years of clinical experience in behavioral and mental health and maintains an independent license as a substance abuse and mental health clinician. She returned to Navajo Nation in 2013 to serve and assist providing behavioral substance use and mental health services. She is passionate to implement an integrated behavioral health system with traditional healing, faith-based approaches, and Western evidence-based practices, and serves on various tribal, state, and federal agency committees and work groups. Please welcome Dr. Michelle Brancer.
Well, hello, Yate. Hopefully you can hear me okay. Okay, great. So I'm so happy to join and was invited to be a part of this conference seminar to ensure justice. These are big issues. I know you've all spent time really collaborating, partnering. But I want to say yo for office of president, vice president, first lady, and second lady. Obviously, those of you at Vanguard University kind of inspiring this, as well as all our presenters. I've learned a lot too, as I've been reminded of these issues, and to all of you participants that are learning and engaging in as well. So I'm hopeful that the PowerPoint I sent that will be pulled up here shortly. While we're looking for that, my clans are Nasht Eja Nishle, Tolbajni Aji Bashichin, Kia Ani, Dash Che, and Toruchini Dashanale. So, or would you all like me to share the PowerPoint? Okay, great, I will do that. All right, so let me quickly get there. I'm on my laptop this morning, just like some of you. There's a lot of graduations going on, so kind of running around and doing all sorts of things today. So let's see, share screen. See if I can get it there. Okay, hopefully you can see that now. Yes, I hope so. Okay, so what I'm going to be speaking upon is our approach to substance use here on Navajo Nation, and was stated before, it's been a journey of mine, and I was reminded again, attending some graduation at Navajo Preparatory School this morning, just the hopes and dreams we all have growing up to hopefully come back and to share all that we've learned and engage our education, our expertise. But coming back home means you also are kind of adapting again to living, and breathing in the way of life that manner. So I think this is it. Okay, there we go. So I just wanted to kind of update everybody. I'm sure some of you already know these facts or tidbits of information. So really sometimes I like to ask people, who are the Diné people? And some of you before COVID, like myself, maybe like to travel, going to other countries, and, Diné, we can look like a lot of other nationalities as well. But it's interesting when you run into people and, from wherever, and even other tribes, and you get to know one another and really understand, your history. And I think that's a real basis of how we look at substance abuse or use on the nation, as well as our resilience of what we've been through. As stated, our elders, those who've gone before us, have endured many challenges that you'll see here, and those 1 through 4 items, and many tribal nations or indigenous people have, been through struggles, to maintain who they are, to really overcome any barriers and things that we talked about earlier. I've heard some of the speakers speak about, just the areas that, could lead to, challenges of trauma, things like that. And so just in the corner there on the right-hand side, just gives you a big picture, I guess, of how the land base is large for Navajo Nation. And with that being said, I just was reminded as I come back to work for Navajo Nation, how vast our nation is and how diverse we are. I've worked for smaller tribes throughout the nation, mainly in South Dakota or in the Northwest region. And really just understanding, with the bigger tribe also adds more challenges at times. But since we're talking about substance use, this is an area that I really was inspired, just seeing, the issues growing up. And some of you may be familiar with Gallup, New Mexico, or Nana, Georgia, in, that border town and the New Mexico side of the nation. And back when I was growing up, it was very much, a lot of negative stereotypes or stigma for Native Americans. And I remember that. And mainly was revolving around substance use. Yet, as we all know, as Indigenous people, at some point, education or the boarding schools came to us as well. And then in a sense, it kind of makes you feel, or I've heard and read in some research as well, that living in 2 worlds or maybe multiple worlds. I know one of the speakers talked about like Swiss cheese in that way, and just different circles around one another. And what I gave is just a little brief example, again, how that might look like, when you're off the nation, though, just like I heard today, being expressed by our president, Nez, to the graduates at Navajo Preparatory School this morning, that, they're charged with a lot of responsibilities in some ways of going off the nation many times to complete education or goals or join the military or other things like that. And so quickly, you can begin to encounter, as even on the nation, the Western and the challenges that can come with that. And I wanted to speak briefly about different stereotypes, as I mentioned, growing up on the nation, but also in other Native nations, in the country. And even sometimes if you travel, like I said, learning about other Indigenous nations, there is a high rate of substance use. That is what we have come to continue to try to figure ways how to address that, how to make sure that we are going to be more in the low risk rather than the high risk for substance use. And as the first slide showed, there's reasons for why the past or history may show more high risk as opposed to low risk. But what's interesting, even as we move on, is we'll see, we are making a dent. We are ensuring with what the resources we have and what we understand about substance use now that we can, encourage one another in that recovery area. So nowadays, we also talk about social determinants of health. And you all may hear that term now more at the federal level, state level, nation level. And really, it's in 5 domains. It's looking at how in your community or in your region, the conditions that are there, They can be your lifestyle, how you're learning, like your education, how you work, how you play in a sense of recreation. Again, how you really have engaged in your community, and those things all affect our health. They all affect the different functions we all have in our communities and our families, in our own self and our strengths and our abilities. So that really can put us even in a realm of, like I mentioned, I guess the more negative stereotype I shared when I was growing up in the Gallup area. That was a negative, more stereotype of how people could have seen than the Diné people, at least those that were in town, in those regards, with unsheltered or homeless or things like that. But now coming back home, as was stated, there is challenges still there. I don't necessarily live in Gallup right now, but on the nation in Pinedale, Topahuiscan, and that is another area, where you can see how your community and these social determinants of health can lead to or kind of contribute to those high and low risk factors. And again, just how diversity is, all across the nation. We're all individual in that way in our families. I think even history for our Diné people, we always, didn't necessarily have, like now we have a president that we elect and, leads our government with vice president and the council. But history-wise, just with the Diné people, there were different parts and bands of Navajo or Diné. So, it was a challenge. There all these individuals and bands were diverse, and we can still see that today. And then the other thing I wanted to mention as well is how, again, the research, as I was reminded of, kind of focused more on the negative. Like they, in the 50s and 60s, thought there was a gene, for Indigenous or Native people that made them more susceptible to substance use disorders, alcoholism, other diagnoses related to those substances. And nowadays, as you look in the research, current day, I should say, there's more research that says that's technically not true. We are just, as any five-fingered being on the earth, have the same, response. If you are going to have these different categories, I'll go into next, of how you might use a substance. There are people, even I'm sure, Native or non-Native, we can kind of look at these categories. But the interesting thing again about research now is it is showing that we are doing better in the sense of that it sometimes isn't always rising to the occasion of maybe where we were in the past, but yet there's still a lot of work to be done due to our more high risk factors or the social determinants of health that I mentioned earlier. And so these are the categories 1 through 4 that list more of how we would look at a substance or a person's substance use. Obviously, abstinence is someone who doesn't use, has no desire to use, just, that's either how they raise or they just don't do that, or they have chosen not to do that, or that's their family's influence as well. And then we have others maybe in that social realm. And, if we work with people who are more at number 4 level, they don't think that's possible because of their, challenges of just finding recovery, of not falling back into relapsing or struggling with substances. So social drinkers, or somebody that's using socially in a sense, can, literally, have something, whatever it is that substance uses, and then they may have it once in a great while and they don't feel like they struggle with it, and it's not really a thought for them. And then the next part that becomes more problematic in the categories is that it starts becoming, for those that more at risk, heavy recreational use can begin. And that's where, more risky behavior starts happening. That line that you thought you would maybe never cross, you start edging toward that, or maybe legal issues or relationship issues, other negative factors start coming in then. And then of course, at like the 4th category, chronic levels, it's not necessarily a choice even anymore. The body is an amazing, how Creator made us. is amazing in that way that it still tries to find a balance. It still tries to be functional in whatever way it is, even whatever you're putting into it actually. So if someone's getting to that chronic level, you know, their body is still trying to manage for the most part, unless, you know, somebody can overdose, somebody can unfortunately, you know, have other mental health things that lead to other risk factors in this area as well. And so those are kind of the categories when we look at it. You know, I'm not going to go all into diagnosing, but, you know, these are some of the things that we look at to really figure out where someone is, you know, and what kind of help are they willing to participate in. Because again, as some of you may know, if you have people in your lives that are in recovery or in one of these categories, you know, you can't make anybody do anything literally. You know, you must decide that, you know, and have the supports to help you, you know, to get through whatever the challenges that may come with substance use. So then my next question that I wanted to bring up is like, what is addiction then? And I do admire a researcher, you may have heard of him, Dr. Gabor Mate, I think is how you say his last name, from Canada. I believe he's in Canada. And he talks a lot about addiction in the sense of like pain. And that's more like the trauma response. Where is your pain coming from? And that's why I chose this image here, is because a lot of this, you know, kind of contributes to pain, you know, the stigma, shame, you know, the embarrassment, your guilt, your health issues that, you know, you shouldn't be doing something, but you're still in the same cycle of addiction, and on and on. So with that, you know, if you, you know, so desire, you know, he's got some really good resources online. And I like showing them even to the treatment center that I've worked at before, because it really helps sometimes people to understand, you know, it really is something deeper that's going on within them, and what is, you know, leading them down that road of addiction. And then I wanted to share also the area that, you know, is still and kind of more prominent in the research is challenging is our Native American youth, or young adults, 18 to 24. You know, there's surveys that are done by the federal government, like this NSDUH is a national survey for drug use and health. And this one was done in 2018. So they'll be doing it again at some point, but it's still showing, you know, we have high rates for our youth. And again, this is why this type of conferences are very important, so we can start helping. And then also on the nation, how we work within our own programs and team up or partner with one another to make sure that, you know, we are providing those avenues to assist our youth, you know, and offering those supports. And their risk factors are very similar. You know, we talked about social determinants of health, and the same thing with their risk factors, trauma. You know, again, that approach of, you know, what did happen, you know, really trying to help somebody. And that's a long journey. When I think about substance use treatment, you know, was typically 30 days in residential or even outpatient sometimes. And even then you're just beginning to work on if someone is really engaging in their recovery, or just trying to figure out what they need so they're not using substances as much or anymore. That is a lifelong journey, you know, and you think about all that I'm sure was discussed here by different presenters. You can see, you know, it is something where it can be intergenerational, because, you know, you're trying to affect the future generations so that they don't have to walk down that same path. And then we talk about the violence, poverty, again, education. And then there are, as we all know, we don't live in a perfect world. People have biases. People can, you know, still discriminate and, you know, feel the effect of that. So for us here at the Navajo Division of Behavioral Mental Health Services, sorry, we have a long acronym, DBMHS, but really how it began is, you know, we work with Indian Health Services, but Indian Health Services has its portion of what their task or their scope of work is, like in the healthcare and more even in the mental health, because that's where you'll find the psychiatrists, at least on Navajo, the clinical, some more psychologists, you know, the type of maybe more Western side of counseling, but I know they also have some practitioners as well. So for the Navajo DBMHS, this is a tribal program, and how we work with the different areas in our scope are, again, really looking at how do we prevent. I know some preventers talked about the different levels of prevention, looking at both substance use and mental health, because as you know, they intertwine. We are holistic beings. You can't just separate, this is just the substance use, is just the mental health. They do affect, everything kind of affects one another. So we have to look at that bigger picture as well. So we do that when we look at prevention, our outreach in the communities, making sure that we provide that level of education for whatever audience that may be in English, Navajo, however we can, help people to understand, there is still hope, if someone is in this path of substance use and really finding it difficult to, abstain or stop their use or reduce that. And then again, that is their treatment or in the aftercare services. And aftercare is really looking again at those supports around an individual while they hopefully maintain their recovery or staying away from the things that brought them into the treatment in the first place. So as I mentioned, holistically, we're strengthening all those areas mentioned there, the mental, the physical, or cultural, or spiritual being, so we can, hopefully, prevent any further, challenges or issues, problems that can come up. And then just wanted to give you a little history about DBMHS, or Navajo Nation. Back in 1968, Navajo Nation started coordinating those healthcare programs and services. So like I was talking about IHS, things like that. These are things when we're looking at how do we look at the healthcare system here on Navajo. So that really started the planning and the organizing back then. And then not too long after, in 1987, that's when will now be DBMHS, but before it was Department of Behavioral Health Services, DBHS. And I've been here since that time where we made that change to add mental health. Sometimes that can be a little bit confusing nowadays, but if we look at a holistic approach, we can see substance use and the issues, the symptoms of mental health and how they affect one another there. And then also, looking to work with the states, Arizona, as you remember that, probably that picture I showed in the beginning, most of the nation, Navajo Nation is in Arizona. So since 1995, we worked with the state of Arizona in an intergovernmental agreement to assist in helping provide more treatment services, like hospitalizations, stabilization is needed, other treatment centers, group homes, if you will, to really help people stabilize. But unfortunately, most of those, or if not all of those facilities are off the nation. And so that's our big challenge here on Navajo as we grow and expand in our own way, is how to develop these facilities here on Navajo. So again, they're not having to go off and be kind of just disconnected in that way. And this is just a quick map of how we have our different sites. And you can see agency-wise, we're in pretty much every agency, mostly outpatient treatment centers, and one residential facility. I've mentioned to you some about the prevention, outreach, and ways that we use our curriculums. One model is the Navajo Wellness Model, and the trainings. I'm sure some of you have heard about Question, Persuade, Refer. That is a new kind of initiative or executive order within Navajo Nation that new employees are trained in this Question, Persuade, Refer, so that they can become what we call gatekeepers to help that those kind of mental health or any type of ideation or self-harm would come about, that more tools to help. And then also for DBMHS, we have done social media outreach since the pandemic, also about 2 years ago. And this just lets you know a little bit more of the outpatient and residential treatment services. The biggest one I'm going to highlight here is the traditional healing services and our faith-based, because as in many ways we understand at least our core, is our own spirituality, whatever that spirituality may be. And so we look at ways of how to support someone's desire in recovery to, make sure that those supports, if it's through faith-based or other traditional supports, we can keep building upon those. And with this, I mentioned the Access IGA. And again, this is where more substance use and mental health treatment can be provided for our clientele, if you will, or the members that are enrolled with Arizona Access. And again, this is the other slide I just wanted to point out again is a huge component. As you see, it has all the same. If you look at the Western modality, traditional, cultural, spiritual, same process, and how we can look at supporting the traditional teachings and the ways that we may have grown up in or re-engage in if you're coming back into that. So like the ceremonies listed below, we do have traditional practitioners on board that are able to assist. And that's been really important as we continue to move through this pandemic, because I know those services have been the ones that have been probably most impacted as well because of the distancing, physical distancing, the masking, the ways that we've had to work through this pandemic. So overall, we're always looking to enhance our services here on Navajo. So looking at partnering, with other entities. I'm listing grants here that we've been working with, a tribal opioid response grant, and also FEMA. That is for crisis counseling care. So we're really looking to get that off the ground here soon with a crisis counseling phone line for both traditional component as well as the more Western-based component as well. And then for the CHAP, that is for a community health aid program and assessment planning, so that we can see if we can develop that even to a greater extent here on Navajo. And lastly, one of the ones is our mental health coalition. Because of the pandemic, we have really, had to engage in whatever ways to get our services connected, meaning IHS, 638 healthcare corporations that are more tribally run and other tribal programs under Department of Health, had to really work more strongly together. And so those partnerships, we were established, this mental health coalition. And it really has been kind of a challenging area at times because the way we're set up is separate, but really finding those inroads to make sure that we are working together to provide the help that's being requested for our Navajo people. And so again, it shows if we have gaps in our services, it shows, how do we look at the data that's coming in from different parts of the nation and how do we work with our services. And then lastly, I just wanted to share with you a resource, kind of like some websites and whatnot that you can go to under the Navajo Department of Health. There is the resources underneath, and I kind of walk you through the tabs there since I'm not showing you on the website. You can download it. It's actually a PDF version of resources that are on Navajo that we thought were very needed for people, especially as a lot of the governmental offices were closed for some periods of time during the pandemic. And now as we open up, continuing to make connections there. And then next one, we do have our own Facebook page. It has a lot of wonderful information, a lot of presentations itself on teachings on both traditional spiritual components, curriculum-based, other things that, like there's no Mental Health Awareness Month, things like that, that we really target and try to make sure we increase our awareness in that. And then lastly, with our own website, NNDBMHS.org, there's, you can find, like, if you're, thinking we do need to have somebody help in that area, the offices are listed on that web page. And just a quick note that we are providing in-person services. During the pandemic, we definitely did more telephonic by phone due to our phone connectivity and broadband and all of that hasn't been. We're still working on developing that infrastructure here on Navajo. So telehealth is good for those that are able to have those connections. But for the most part, telephonic was kind of how we had to continue services. But now For the last month, I would say, we're in person as long as we can follow our health safety guidelines, here with our mask mandates and physical distancing and all that. So anyway, that's just a little bit of synopsis of our resources. And I hope that helps you just kind of gain that, I guess, maybe more awareness of what we are looking at, how we approach, this issue that is still, in our nation as well. So thank you. Yeah.
So much. I'm really looking forward to downloading that PDF and digging through those resources. So we're going to hear from Dr. Brenda Navarrete. And Dr. Branson, will you stay with us for the rest of this? So because we'll do some Q&A at the end.
Sure. Yes, that's fine.
So Dr. Navarrete is adjunct professor here at the Global Center for Women in Justice, and also is a crisis intervention practitioner of Alabaster Jar Project, a long-term residential program and resource center for women who have survived human trafficking and sexual exploitation. So I'm going to let her jump right into her PowerPoint.
Hello? Okay. So today I want to talk to all of you about mental health and just the importance of mental health, the role of mental health, and a few things that we can do to help improve overall mental health in children. And of course, a lot of these work for us as well as adults, right? Because as caretakers, we need to be healthy ourselves so that we can give and we can help provide support. So mental health includes our emotional, our psychological, and our social well-being. There's a lot of factors that contribute to our mental health. There's things like some biological factors that might play a role, and also experiences, things like trauma, things like, difficult or happy experiences. All of those kind of combine to contribute to our mental health. So just a couple of numbers. It's estimated that about 1 in 5 U.S. adults experience mental illness in their lives. So if you think about it, if you're sitting in a full room, I know we're not in a full room here, but if you look to the person in front of you, behind you, to the left and to the right, one of you will experience mental health in your lifetime. Or a mental health illness. So the numbers are big, right? And according to the World Health Organization, depression is the leading cause of disability worldwide. And mental health is important at every stage of life, right? From childhood to adolescence and into adulthood. And it affects every part of who we are, how we think, how we feel, and how we act. It also helps determine how we deal with the stressors in our lives, how we relate to the people around us, and the choices that we make. And impacts our physical health, as Dr. Morgan shared earlier, with the ACEs information, and our ability to learn, right? I talked about how with trauma-informed care, in the trauma-informed care presentation, for example, we talked about how that prefrontal cortex has to be engaged for us to be able to learn. And when we are in a state of stress, that is shut off and we cannot engage and learn. So something that has this much importance in our lives needs our time and our attention and our care and our conversation, right? Unfortunately, there's still such a stigma, even though it plays such a big role in our lives. We still don't often make it a part of our regular conversation. So that's unfortunate. And I just think, mental health is an integral part of health. There really is no health without mental health, right? And mental health is also associated with human trafficking. So the United Nations Office on Drugs and Crime identified mental health difficulties as one of the top pre-existing vulnerabilities in victims of human trafficking. And one of my responsibilities at the residential program where I work for trafficked women is to handle all the inquiries and all the evaluations of the referrals that we get. And I gather a history. And it is a consistent pattern that mental health difficulties, problems in the home from early on, sets up a vulnerability human trafficking. So it's important that we see the role that it plays in all of these different areas of our life and how it adds to vulnerability. So promoting the mental health of our children is critical, right? And building emotional intelligence and emotional resilience is something that should be a focus for all of us in order to build up communities. And I love how they were referring to the 7 generations, and I love this idea. And this is something that as we think to the future, as we think to future generations, it's so important that we invest in mental health of those future generations. And there's so many stressors that kids deal with these days, right? There's peer pressure, there's social anxiety, self-image issues, all of the things that kids deal with. And these days, of course, we have the added stress of the pandemic. So especially during these unprecedented times, it's important that we learn ways that we can build mental health. So one of the things I don't know about all of you, but something that I sometimes struggle with when I go to conferences is that I have all this information, but I'd say, what can I do practically on a regular basis? How can I contribute? Where's my role here? So one of the things I wanted to share with you guys today is 5 simple things that you can do to improve emotional and build emotional intelligence in kids, but these all relate even to all of us. So it's for kids and for us. So I'm going to talk about 5 things. So the first thing is for us to, let's see if I can get this working. Yes. Talk about mental health, talk about feelings, talk about emotions and how to process them, because unprocessed emotions can lead to a lot of difficulties as they grow, like things like anxiety, depression, aggression. I think that one of our biggest umbrella jobs as guides in the lives of young people is to recognize and build their need for self-regulation, right? We had Dr. Brancer talk about, substance use. And so many times in my experience in working with women in recovery has been helping them feel those difficult feelings and teaching them that they can endure them, they can sit with them, they can process them, because their instinct is to go to something that will numb them and will make them go away, because they were always taught to shut those out, not to talk about them, not to process them publicly. And so it made it easy for them to run to something that will just make them go away. And so it's important that we teach them and we make it okay, to process these emotions. Doing things like reaching out to others, crying, talking about them, and venting a lot of times wasn't acceptable, right? And I think it's important to teach kids that it's okay to cry, it's okay to feel these feelings, and it's okay to talk about them, for boys and for girls, because I think sometimes, especially boys, we teach them that they shouldn't cry, or they should just be tough, or they should just get over it or deal with it. And so they learn that they need to shut that out and they need to not process that. So I think it's important that we talk through them. And that we allow them to process those feelings. And as parents, we sit there and we listen to them. I had shared earlier that I know as a parent, it's like you want to rush them. You want to get them to a happier state or a more neutral state. But it's important that we allow them to go through those. So what do I mean by, what we want to teach them? Coping skills, how, better ways to deal with their emotions. So here are some simple coping skills that we can use for kids, as early as 2 or 3 years old. And these can be used all the way through to the teenagers. Some of these are great for adults too. And these are just some general ideas, but you can tailor them according to your kids' interests or their age. And some incorporate things like physical exercise, which helps get rid of some of that energy that we talked about from the stress response. Some of them incorporate grounding, like what we did earlier, kind of the same idea of helping them connect to the present moment, but they're all focused and have been shown to improve overall mood. So it's important that we, teach our kids, help them to recognize when they're feeling upset, teach them skills that they can use, and then talk ahead of time about how we're going to incorporate these. So we don't introduce these when they're already mad, right? I think a great way to do it is wait for a time when everything is good, everything is happy, everybody, you're in a good mood. I wouldn't do it before I've had my coffee in the morning, for example. When everybody's kind of just everybody's kind of in a good mood, and we say, hey, we're going to talk about feelings and emotions. There's going to be times where you're going to have some strong feelings. What can we do in those moments? Is there a special spot, like maybe out on the bench, where we can keep, a plush toy that you can hug and you can sit with if you're feeling upset, or other ways? If they're a teenager, maybe there's some music that we can have, a headset. You can go and listen to some music in your room, but that they can recognize that there's a process, there's a plan, and that there's things that I can do to help myself when I'm in that place, and that are within my power to be able to help manage. So have a plan, and I think that kids, when they can feel understood and acknowledged, without judgment about their mental health, they're more prone to be able to process these and be empowered. So I want to kind of think back on my talk about trauma-informed care for just a second. Now, does anyone remember the 2 brain modes that I talked about? What are the 2 brain modes? Does anyone remember? That's right. There's learning brain and survival brain. So another way that we can kind of help kids talk about mental health and feel more empowered is to talk about how our mind works in that process of the fight or flight and all that. But how do we talk to kids about that? So I have a fun way of showing kids about that process, and it's called the hand model of the brain. And this is an idea adapted by, it was originally an idea by Daniel Siegel, but it's kind of a version of that. So I want to kind of show you guys this. So you start with your hand, and this is the hand model of the brain. So down here at the bottom, we have the brain stem, right? And here on our kind of our thumb is our survival brain, right? And up here, we have the prefrontal cortex, okay? The front part of our brain, that's all the executive functioning. Okay, so formally, this is the amygdala, the hippocampus, the prefrontal cortex, but we're just going to call this the survival brain and the learning brain. Okay, so my kids love animals, right? They're 6 and 9 years old. So we're going to call this part here, the stress response, the survival brain, we're going to call that the barking dog, because a barking dog is always on alert, always listening for, it's like an alarm system, right? And then my kids loved the Adventures of Winnie the Pooh. And on that show, there was a wise owl, right? He was a problem solver and very intelligent. So we'll call this the wise owl. Okay. So remember, when the dog barks, the owl gets flipped off and has to fly away. Okay. And so what we want to do is help calm that dog. My kids like to say, put him to sleep. So then the owl can come back. Okay. Because it has nowhere to land unless that dog is asleep and calm. So, we often, when we address difficulties, we want to start with problem solving sometimes. We do this as parents, but it's important to recognize that first we have to meet their safety needs. We have to calm them down so that then they can come back and be able to problem solve, right? And this has been a way for us to talk about it. When my kids are having a hard time and they're argumentative or they're just struggling, I just say, hey, is your dog barking? Is there something we can do to put him to rest? Sometimes when I've overreacted as a parent and I realize I just have had a lot of other things going on my mind and I think I reacted too strong, I can talk to them and say, I'm sorry, I think my dog was barking, my owl's back. I can have a real conversation right now. So it's kind of a fun way that we kind of use to talk about how our mind works. So, and I did want to mention also that I have a more comprehensive list of coping mechanisms that I attached on the SCED on the presentation, with my presentation. So now the second factor that I want to talk about is supporting good physical health. As Dr. Brancer mentioned, she said we are holistic beings, right? And so making sure that we also incorporate good physical health is really, really important. We want to make sure that we are having regular sleep patterns for kids. Sleep is so important. Most kids out there actually don't get as much sleep as they're supposed to. And so it's important that we incorporate healthy eating, healthy sleep patterns. and making sure that they get sunlight, that they're outside, they have spent plenty of time to get exercise. And then the third factor that I wanted to talk about is gratitude. I'm sorry. Okay. Making sure that we are grateful and we practice gratitude. I have a little gratitude journal that I brought with me, so feel free to come and look at that. And there's also a lot of great books that we can use. And number 4 is building connection. And I've talked about connection in the past, but keeping in mind that that connection is connection to ourselves, connection to their community, their faith group, and to their traditions is really important. And then finally, I want to talk about, being a good role model, remembering that our kids are watching us, they're listening, they're seeing what we're doing, how we're handling the stress in our lives. And so it's important to remember that we are the example, and they learn by watching, not just by hearing what we say, right? So talking about your feelings and emotions, supporting good physical health, practicing gratitude, building connection, and being a good role model.
And those slides and resources will be on Sketch. Thank you so much. I have a whole new language for talking about barking dogs. So our final presenter in the last 12 minutes is Alicia Zayas, and she is also adjunct professor and works in the field of anti-trafficking for more than a decade, and was part of our Orange County Human Trafficking Task Force. She has a master's in social work and is a licensed clinical social worker. She started the commercially sexually exploited children program in Tulare County Child Welfare, and now is a behavioral health therapist working with inner city youth in Bakersfield, California, and actively working to develop more prevention efforts in the school setting. And I'm really curious now if there are Native American people in Bakersfield, California.
Yes, yes, and all around us. So thank you, Sandy, and thank you, Navajo Nation, First and Second Lady. It's such an honor to be here today and to just be part of this experience with you. So thank you, thank you, thank you.
Oh, Alicia Zayas.
Sorry, my name's Alicia Zayas. Yeah. Okay, so I'm going to be talking a little bit about child sexual abuse and how that feeds into human trafficking. And so this quote, I think, really helps us see where this gets to the heart of, right? Incest is boot camp for prostitution. If we look at that, we can start to see how ingrained some of these behaviors and ideas are if somebody's being sexually abused as a young child. So I want to go through briefly the continuum of sexual abuse. This was created by GYMS and is a great organization out there that address commercial sexual exploitation of children. If we see that a child's starting to be sexually abused, typically they're being abused at, maybe a young age, right? And then they start linking sex and or abuse with love, because who do we know are typically the abusers? They are typically somebody that child loves and or trusts, right? A trusted adult in their community. And so they're starting to link love and sex with with abuse and sex. Their boundaries have already been violated as a result of that abuse that's happening. We know that guilt and shame are very common symptoms that come along with that. And they might begin to view themselves as a sexual object. Maybe this is what I was created for. This is who I am. And if they're starting to believe that about themselves, it makes it a lot easier for them to accept that, oh, well, this person's willing to give me something in exchange for this, I might as well get that, right? Or my boyfriend's telling me that, I might as well get paid for this, right? I'm already doing this with other people. And a lot of times, there's low self-esteem or homelessness that comes with that because maybe they're running away from the situation, they're trying to get away, and that creates this poverty and need for a child. And they don't have the same opportunities and experiences as adults do, right? They don't have the ability to go and rent a hotel room or go to a shelter because you have to be 18 years or older. They don't have the ability to go find a job like any of us could to be able to support their basic needs. And so that's where the exploitation piece comes into play, right? Where somebody is preying upon that child and looking to fulfill their needs, those basic survival needs. And so all of these things really kind of create the perfect storm, the perfect opportunity for a trafficker, an exploiter to take advantage of a child who has that history of sexual abuse. So we can see how easy that transition might be for a child to become a commercially sexually exploited child. All right, so a few statistics for you. I'm not going to go into all these details. You have my PowerPoint, but the key factor here is that the fact that a child is sexually abused makes them 28 times more likely to become a victim of commercial sexual exploitation. That's a major red flag. That's a major vulnerability. So we want to make sure that we're taking that into account and looking at that vulnerability in working with our youth. A few important factors when it comes to our Black and Brown communities, in particular, some of the research that's been done around the Native communities. Melissa Farley did a research study a few years back where she identified that of the sex trafficking survivors that they interviewed, 79% of respondents reported having been sexually abused as a child by an average of 4 abusers. And this was specifically research done for women in Minnesota, sex trafficking survivors in Minnesota. So just again, important figures and facts for us to keep in mind as we're working within the community to identify what are those red flags, what are those risk factors that put them at greater risk for trafficking in the future. So we've got to go upstream. We've got to look at those preventative measures and build that resilience before these things end up taking place. These are just a few, again, risk factors, vulnerabilities that you can look at later, but some of the key elements here: unstable housing, runaway, homeless youth, substance use concerns, right? Those are some of the major risk factors that the Polaris Project, who runs our national human trafficking hotline, have identified. These are the major risk factors and vulnerabilities that are placing people at risk for both sex and labor trafficking in the United States. So how do we build that resilience? Well, schools, parents, community members, leaders in the community, friends, we are all in the perfect opportunity to take advantage of, using those relationships with children, connecting, providing safe space for them to be able to know who they can go to trust, to access resources and support. We've got to be able to support our kids who have experienced trauma by establishing those meaningful relationships and helping them feel safe and supported, and knowing, again, who they can reach out to, who they can go to for that support. Developing those trusted relationships and creating safe environments are at the heart of this issue. I know we're running out of time very quickly. So moving on to pornography. This has to be a part of our conversation as well, right? And I just want to highlight that Ms. Wood, who had spoke earlier this afternoon, stated that terminology makes a difference, right? There is no such thing as child pornography. I just want to make that very clear, right? There is no such thing as a child prostitute. We see this as child sexual abuse material when it comes to pornography or videos or pictures of children in a sexual way. And so we really want to make sure that we're highlighting that, identifying that, Pornography is used by many perpetrators of sexual abuse of children in particular to both normalize that sexual abuse experience. And so we've got to, we can't ignore this issue, right? It has to be a part of this conversation. We've got to identify that, this can't just be a normal part of our society. We can't accept that this is just, it's not hurting anybody, because the reality is it is. And there's some research behind that. I don't have time to go into the details, but the Polaris Project put out some data specifically on that. So let me see. I think there was one other thing. Okay, yes. So prevention, again, we want to build that resilience. So online safety is so important for our children, teaching them how to be safe online, how they can let an adult know when something that isn't safe has happened, because it is more than likely going to happen. They have access to the internet, a lot more than I know we ever did. And so it's just really important that we're teaching them how to be safe, how to acknowledge, when there's something that's dangerous that they come across. NetSmartsKids.org. This is a wonderful resource. It's completely free. They have resources available for teachers, for law enforcement, to be able to integrate lesson plans, to be able to do presentations without having really any background in this particular issue. It's a wonderful, wonderful free resource. So I just want to encourage people to go out there and take a look. And then, of course, please do not hesitate to report if you suspect somebody is involved in a trafficking situation, or if somebody's needing that support or resource. The National Human Trafficking Hotline, 888-3737, 888. And they also have a text number, Be Free, 233-733. Again, that's available 24/7 around the United States. So I will wrap it up. Thank you.
Thank you. And I know we lost some time at the beginning, so you'll want to go back and look through the slides and take some time. I'm particularly impressed with the amount of resources in those slides. You've got book lists and links to resources for prevention. And I can't help myself, timer, but prevention, we talked about that with Catherine Chan last night. And I just want to give you a very simple public health model of prevention. When you know there's something bad happening, you have to find out why, so that when you see that, you can predict what's happening, develop a plan to protect against that happening, and then practice that plan over and over again. A great example of what every person in this room has done. You know that if you eat candy, you're going to get cavities. So what do you do to protect your teeth? You brush your teeth, and you don't do it once a year. You do it every single day. So you predict, you protect, and you practice. And for our kids to be safe, we know that if they're online, they will be approached, they will see material that's risky. So we need to predict, and then protect, and use these free resources. Not one time. Okay, you're done, but every day, just like brushing your teeth. So thank you, everybody, for putting your calm, anxious, free, quieting the barking dog with our technology issues. Thank you, Dr. Brancer. Thank you, Dr. Navarrete. Thank you, Alicia. And we'll get ready for our closing plenary now.